current data. Over 100,000 children tested positive, along with thousands of teachers and support staff just last week. We're all living and working with the consequences of national government letting COVID rip through our schools and communities. Hopefully by the end of this evening, you'll have loads more information that's going to help you go out and push back against this and take some action. We've got three brilliant speakers who've all been at the forefront of speaking out against the appalling situation and failure to protect education workers and children in schools since the beginning of the pandemic. We've got leading epidemiologist Deepti Gurdasani from Queen Mary University of London. We've got Janet Newsham, the chair of the Brilliant Hazards Campaign Group, and Jenny Cooper, vice chair of the National Health and Safety Organising Forum. So without further ado, we'll start with Deepti. Deepti, you're very welcome.
Can I just share some slides?
Absolutely.
I just need permission from the host.
Okay. Sarah or Sam, can you sort that out?
Yeah, I've got it now. Thanks. There we go. Can you see that? Yeah. Okay. Yeah. So I'm going to quickly go through sort of where we are right now with the COVID situation in the UK and in children. So, while the dashboards look sort of green, I think we need to remember that we've had record high cases actually for a really long period of time, unlike most countries. And we've sort of normalized having 40,000 daily cases, having over 100 deaths daily, and having about 700 to 1,000 admissions per day. So this is not a good situation to be in to start with. Where are we in terms of infection in children? So in 10 to 19-year-olds, infections are probably the highest that they've ever been in the pandemic. So they're above 1,000 per 100,000, which is essentially 1% of the population in that age group getting infected every week, which is, as you can imagine, extremely high. And if we look at this in terms of breakdowns, you'll see a mixed pattern where sort of there are perhaps declines in the age group 15 to 19, where, many more have been vaccinated versus sharp rise of the 10 to 14 age group. So what we're seeing is a pandemic that's mixed based on who's been vaccinated and who hasn't. And we're seeing the highest case numbers we've ever seen in children at about 17,000 per day. And that's confirmed cases. Of course, there are many, many, many more children who will be getting infected and not be symptomatic or not coming forward for testing because their symptoms are atypical. And if we look at the general survey, which is not dependent on children having symptoms and coming forward for testing, then the picture looks even worse. So about, 1 in 40 children, primary school age group, and 1 in 20 children in the secondary school age group have infection. So that's, between 1 and 2 children in every classroom on average are infected. And you can see the comparison with other age groups where infection rates are much, much lower, not rising, whereas they are sharply rising in school age children, particularly in the secondary school age group. And, this picture, I think, says it all. This is the number of infections we've had, or confirmed cases rather, in different age groups. And you can see the 10 to 19-year-old age group where we've had about 140,000 children with confirmed COVID in the last 2 weeks alone. And if you look at the total number in children, it's about 180,000 in 2 weeks. So that's just 2 weeks. And if you imagine, even if you believe that long COVID is very rare in children, as some people say, so if 2% of them develop long COVID lasting for 12 weeks, that's 3,600 children with long COVID. So persistent symptoms lasting 12 weeks or more, which is quite significant, in just 2 weeks. So if you extrapolate that, that is a huge impact on children. And if you consider 14%, which is actually one of the best estimates we have from one of the most comprehensive studies, that's 25,000 children developing persistent symptoms in just 2 weeks. And, unsurprisingly, you see this reflected in the ONS long COVID survey, which came out today and shows that 53,000 children have currently persistent symptoms for 4 weeks or more, 29,000 with 12 weeks or more, and 11,000 children have had symptoms for more than a year after COVID So these are children potentially with chronic disability. And unfortunately, the picture isn't better for educational staff either. So about 2% of all educational staff reporting long COVID for 12 weeks or more. And this is the fourth highest rate by occupation. So there's healthcare, there's social care, there's transport, which is comparable to the education sector. So they're third or fourth in the ranking of all occupations in terms of long COVID. And unfortunately, despite what everybody says about children not getting sick, they do. And this translates into a high level of hospitalizations. We've had almost 10,000 hospitalizations with COVID so far since the pandemic started. And we've been having more than 1,000 hospitalizations a month since July. And in September, we had, again, over 1,000. And, we shouldn't accept that. And we're having 40 to 50 children, sadly, getting hospitalized per day. In September, we've had about 10 children die with COVID. And unsurprisingly, educational settings are one of the largest setting for outbreaks, which is the light blue color here across the UK. This is even worse for England when you look at the picture in England. And, unfortunately, the messaging around vaccination, the delay in vaccination has really endangered children. I mean, this is our work that's been published in the Journal of the Royal Society of Medicine, which looks at current rates, which are equivalent to rates or higher than rates in July in adolescents. And it shows that in a period of 16 weeks, we could have prevented about 4,500 hospitalizations with COVID and about 18,000 children getting long COVID, even with very conservative estimates. And we could have prevented even about 36 children dying of COVID over 16 weeks if we had vaccinated over the summer, which unfortunately we didn't do. And this is the very striking picture with vaccination. So although vaccines for adolescents were approved by our regulatory agency, the MHRA, on June 4th, and JCVI, after a huge delay on July 19th, said at least adolescents with pre-existing conditions should get vaccinated, which was expanded to all adolescents on the 3rd of September. Very little has happened in reality. So this is data from today that shows 8% of 12 to 15-year-olds. So remember, 13% of 12 to 15-year-olds are vulnerable. So not even all of them have been vaccinated. 8% of that population has been vaccinated, compared to Scotland, where 30% have received one dose. So there's a huge difference in rollout. And we are hearing from many parents and schools about the difficulties in accessing and giving out vaccination. And there are huge differences in rollout, because in Scotland, you're allowed to go to walk-in clinics if you're 12 to 15-year-olds and get vaccinated, whereas in England, you aren't. And, sadly, these delays have consequences on people and families. And, I think everyone here is aware of this really tragic story of a girl who died of COVID myocarditis. So myocarditis due to COVID, which is much more common than vaccine-associated myocarditis and can kill. And she died the day she was due to get vaccinated. Had she gotten vaccinated over the summer, it's very, very likely she would be alive today, and her family wouldn't be dealing with her tremendous loss. And, in terms of educational disruption, I mean, we've all heard Nadine Zahawi said that, we need to keep children in school at all costs. But the fact is, you can't keep children in schools unless you invest in mitigations and unless, you vaccinate. And that's what's happened. We have mass educational disruption with, 200,000 children off school currently with COVID. So these are not contacts. These are children who are actually ill. And, we are an exception yet again compared to other countries. Other countries, most European countries, have used vaccines alongside mitigations and been very, very careful about opening up. Whereas we've opened up largely supporting a mass infection strategy in children and delaying vaccination to a point where most children will sadly get infected before they get vaccinated. Most European countries have masks in primaries and secondaries, so that includes France, Spain, Portugal, many parts of Germany. They have bubbles, they have social distancing, they have quarantine for contacts. I mean, just to compare how behind we are in terms of vaccination with other countries, you can see we sort of plateaued off somewhere, and we are way behind many countries now. Portugal has vaccinated 98% of their 12 plus population. We've overall vaccinated 66% of our population. So we did really well with adult vaccination, but we've fallen behind badly with children. And, we are dealing with a really uphill task. So, this is not lack of knowledge, lack of information, lack of, evidence and science. What we're dealing with is skepticism within the scientific community and within organizations that are supposed to be protecting children. I mean, I've seen this at Public Health England, constantly putting out misinformation on childhood infection. This is a member of JCVI, quote tweeting us for them. Us for them, you may be aware, claims to be a parent group, which is anti-mitigation, anti-mask, anti-vax, and has been essentially litigating against schools and threatening government with litigations for, if they were to introduce masks in schools. And this is him supporting their Safer to Wait campaign and suggesting through his piece in the Times that parents should wait 6 months before getting their children vaccinated, which means almost certain infection for children at current infection rates and without mitigations. And we also know that there was a former member of JCVI who was very, very friendly with the HART disinformation lobby group, who was also pushing for herd immunity through infection in children. And this is from the Royal College of Pediatrics, so the RCPGCH lead, wrote, essentially gave an interview in the Telegraph and said publicly that she thinks that testing of asymptomatic children should stop. Which is ridiculous, frankly, because most of the transmission happens at the pre-symptomatic stage. And doing that is essentially saying, let's keep infected children in schools. We don't want to know that they're infected, which from a public health point of view will fuel transmission even more and is a dangerous policy. We have MPs paying tribute to us for them. And, in the last few weeks, we've seen fraudulent NHS leaflets distributed within schools by a person who, seems to have been inspired by HART, which is a disinformation lobby group. So we are, really against it here, against well-funded disinformation groups and skepticism within members of the scientific community who should know better. And, there's an active suppression of information. So a scientist put in a freedom of information request with JCVI recently to publish essentially, their minutes and their thinking around what led to the current policy in vaccination, what led them to not recommend vaccines for adolescents. And essentially, we've been told that this comes under an exception in that it will be released in the future. So it doesn't need to be released now, which I frankly think is ridiculous. Similarly, we still don't know on what basis the government made a decision to remove masks in May, because a freedom of information request was responded with the statement that there was greater public interest in not disclosing this information that informed policy in a pandemic, than disclosing it, which seems rather disingenuous to me. So how do we do this? Vaccines are not in themselves alone an answer, although they will definitely help control transmission, reduce educational disruption, and protect children from long COVID and severe impacts. But we also need multi-layered mitigations that almost all countries in Europe, except possibly Sweden, the Netherlands, and the UK, have, which is we need masks in schools, we need ventilation, we need smaller bubbles, and we need to reintroduce quarantine of contacts. Quarantine of contacts is not a way, it doesn't lead to educational disruption itself. It controls spread. What leads to educational disruption is letting infected children remain in school and having really high background transmission rates, which we have. If you have 1 or 2 children in each classroom with COVID, and in some regions like Kettering, that's much, much higher, obviously you're going to have super spreading in crowded environments with no mitigations with unvaccinated children. So yeah, that's it for me. I'm going to stop sharing now.
Thanks, Deepti. That's brilliant. Perhaps we hear from all the speakers first and then cover the questions at the end, if that's okay. Obviously, if people want to type them in the Q&A or in the chat, then we can all see those at the same time. So thanks very much for that, Deepti. So we'll move on and introduce you to Janet Newsham. Janet, Chair of the Hazards Campaign Group. Janet, you're very welcome.
Thank you so much, and it's for inviting me to speak. And it's a real honour to be on the same platform as Deepti and Jenny tonight, and of course you, Ian. I bring solidarity greetings from the Hazards Campaign and the Greater Manchester Hazard Centre, and I'd like to record our thanks to all those safety reps who have throughout the pandemic continued to not only protect workers' health and safety, but also to challenge their employers to protect children their families, communities from soaring infection rates. I would like to start by expressing my heartfelt condolences to those NEU families who've lost loved ones because of COVID, and especially those who have been infected because they continue to work or the risks weren't controlled in their schools. Whilst trade unions and health and safety activists, their main aim has to be to encourage our employers to take a precautionary approach to the risk of infection in our workplaces and in our schools. The government has followed a mass infection strategy, and their inhumanity and negligence has shown no bounds. Now, how have the UK government been able to be so cavalier with the lives of its citizens, resulting in more than 160,000 needless deaths and hundreds of thousands left with long COVID and disabilities, including children? Thousands are facing mental anguish at the deaths of their friends, family, neighbours, and some are teachers and teaching assistants and other school staff. Many children orphaned, living in fear of physical pain, lives shortened or lost, and we'll have to live with the knowledge that none of this needed to happen. The uncontrolled spread of the virus into our homes, communities and workplaces, all because the government's priority is keeping the economy going at any cost to life. Their crocodile tears about education and mental health of children was absolutely shown to be a lie when they refused to put in place the mitigation needed to keep children safe from infection and force them back into infected schools or unsafe schools. As an occupational health activist, I know that the unions and safety reps mostly have to force employers to take precautionary approach to risks, and it hasn't been easy during the past 18 months. Government guidance has continued to undermine health and safety laws, which hasn't changed during the pandemic, but employers have used it as an excuse to not put in place the controls needed or to follow a hierarchical approach to controlling the risks. Occupational risk could and should have been controlled. Infection control is a standard risk in all our workplaces. Employers just need to identify the transmission risks and then work out how to control them. And as we know, the virus is airborne. It isn't and never was rocket science, just basic good health and safety. And it's our employers' legal duty to do this. Even the government paper on health and safety, responsibilities and duties for schools from July 2021 spells this out. The employer, and in the case of independent schools, the proprietor, is accountable for the health and safety of school staff and pupils. The day-to-day running of the school is usually delegated to the head teacher and the school management team. In most cases, they are responsible for ensuring that risks are managed effectively, and that includes all health and safety matters. Many employers have failed to review and produce suitable and sufficient risk assessments, and many safety reps weren't consulted or informed. PPE was not and still is not at a precautionary standard, and many employers have failed to investigate or even report incidents of infections, illnesses and deaths from COVID-19. The UK government from early in the pandemic has misrepresented the risks to health and the controls needed to protect people. They did not make available the financial support to workplaces to ensure that they're COVID safe. And when those legally responsible in our schools failed to act, the HSC failed to enforce, and to date there have been no prosecutions of any employers, leaving workers to make difficult decisions to protect themselves and others. Some reps have been victimised, and several workplaces have had to take industrial action to force employers to protect workers and to protect health and safety reps. So my message is clear. We cannot rely on the government to provide clear and responsible advice to keep people safe and healthy at work. They have continually misled, lied and encouraged infections throughout the communities. They have washed their hands of COVID. There has been a wholesale removal of public health mitigation, as Deepti said. We have to use our industrial collective strength to hold our employers to account and force employers to act. It is a simple choice, your action or your health. But continue to demand a review of risk assessments, a demand to improve the ventilation in our schools. With any new information about variants and ever-increasing infection rates in our schools and communities, force your employers to review those risk assessments. Review them and ensure that a hierarchical approach is taken to control the risks. Section 44 and Section 100 of the Employment Rights Act was used to an excellent effect to force employers and government to lock down. The infection rates in our schools is so high, it is difficult to see another option at this time. The very least, we must must be an immediate layered approach to mitigation, including the public health measures and controls and workplace controls. And that starts with, eliminating that risk, doing things in a different way, substituting the way that you do it, making sure that ventilation is at the highest possible standards. And I know that your union has been putting on training on ventilation. Looking at less people and less time, all the things that we've been talking about all the way through the pandemic. And eventually, if there's residual risk, then there must be a proper standard of PPE. And if employers fail to do this, an individual's final stand must include the right to remove ourselves from situations of serious and imminent danger. It is a right where an individual has a reasonable belief that they are at risk. More than anything, reps need to unite and work collectively and in solidarity across different unions and different organisations to protect themselves, their members and the young people they support and teach. Everyone has the fundamental human right to safe and healthy work in all workplaces and in all circumstances. The government's time of reckoning will come, but in the meantime, we must do all we can to prevent more infections, illness and death, not just for the NHS, but for our communities, for our families and for our friends. We remember our dead, but we must continue to fight for the living. Thank you.
Absolutely. Thanks, Janet. That's brilliant. Thank you very much. I'll move swiftly on, if that's okay, to our final speaker before we get to some questions. And our final speaker is Jenny Cooper, my colleague, my National Executive colleague and Vice Chair of the National Health and Safety Organising Forum. Jenny, you are welcome.
Thank you. Always a hard act to follow Deepti and Janet, our two resident experts that have seen us safely through this pandemic so far. I think we would have had many more deaths if it wasn't for them. Maybe I can just add something about union organising in schools and what we've been doing as a union. There's many other members of our Health and Safety Organising Forum on the call tonight, so we're kind of supported by them as well. So my position is I'm based in a special school, which this week has gone back to a bubble system in its biggest corridor due to the fact that this week we've reached the DFE threshold for the number of positive cases, which should mean that extra mitigations come back in. Actually, the thing that has kept our children away from school and disrupted them over the past few weeks is the fuel crisis, which the government didn't seem as concerned about when that meant that children were forced to stay at home. But there we are. So the DFE has set some thresholds where if schools reach those for the number of positive cases, measures should be reintroduced. The problem is we're all having trouble getting the data on which schools in our areas have reached thresholds. Some of our reps we know are even having trouble getting data on whether there's cases or how many cases there are in the school that they're actually working in themselves, and even in some cases where they might have risked being in close contact with that positive case. Even then, if the system does work properly and public health is contacted, we're finding that the proper measures as outlined on Deepti's last slide aren't necessarily being put back in place as a result of those thresholds being reached, but instead people are being told, well, what you need to do now is really make sure you wash your hands properly, etc., etc. I think there's a postcode lottery going on. We know that in Staffordshire, Cumbria, some parts of Torbay and a couple of other authorities, masks and things have been reintroduced as a result of the number of cases locally. But there's plenty of other areas where the cases are as high, where those masks and other measures are not being brought back in. It's quite clear to many of us that our local councils are not going to save us. It's very clear, I think, to everybody that the government are not going to save us. We are the people that we've been waiting for, all of us here. We're kind of preaching to the converted maybe, but we should be empowered by the fact that we're here as a collective tonight. There's 63 people on this call who've all tuned in because they know that COVID is still an issue, it's not gone away, and further action needs to be taken. So we can be empowered by our union, the NEU, because of all the guidance that they've brought out, which has been consulted on with experts like Deepti and Janet, and joint union guidance as well, that's been brought out on ventilation, on the proper reporting of cases, and the fact that there are exemptions from GDPR so that safety reps can be told about cases in their schools, and also guidelines on protecting pregnant staff and clinically extremely vulnerable staff. And that guidance, some of which has been posted in the chat by Kay Gallimore tonight, so if you scroll up there, you'll find it. A lot of that guidance also explains to you what to do when the things in that guidance are not being followed, how to escalate as a rep or a member in your school to make sure that that is enforced. So we need to use these guidelines that we've got to get our risk assessments revised, as Janet touched on earlier, and also to resist the fact that some of the measures that should be are not being implemented. So Janet referred as well to section 44. Health and safety law states that you have responsibility for your own health and safety, and that you shouldn't enter an unsafe workplace or an unsafe environment. You have responsibility for that yourself as a worker. As a rep, you have even more rights, and as a safety rep, you have the most rights of all. So once again, I would urge everybody that's on the call, that's in a school, if there is not a safety rep in your school, become one, recruit one, find one, get one, share it with somebody else, whatever. We need safety reps in every school. The reason is safety reps have a right legally to see all the documents that carry some legal weight in relation to evidence that all this stuff is going on in our schools. So they have a right to be consulted on risk assessments. They have a right to see figures and details about injuries and infectious diseases and industrial diseases that are reported in the school that might be reported to public health. They have a right to gather that information, and they have a right to investigate that information and to use it. Once they've got all that information, armed with the evidence, they are then safe to say, I can't go into that room and teach today because I've seen that the CO2 monitor shows levels consistently above 800 parts per million. Never mind the fact that the DFE says 1500 parts per million, because we know that's not safe, because the HSE says it's not safe, and building control says it's not safe, and plenty of other people say it's not safe. So we're going to believe them. We're not going to believe Gavin Williamson. So also, armed with the evidence, we're going to say, no, we're not going to allow pregnant staff in our school to have to come in the third trimester when we know there's positive COVID cases in the school. And we're also going to say, no, we're not going to be told that you can't wear masks in the classroom when the COVID threshold, as outlined in the DFE guidance, has already been reached. So the NEU is an organising union. Risk assessment should always be done on a worst case scenario basis. So if you're risk assessing something that could possibly end in death, then the worst case scenario is death. The problem is with safety organising, people only seem to get excited about safety when somebody close to them dies. And many of us that are involved in this kind of work are involved in it because we've had that experience in the past, either at work or otherwise. It seems less glamorous to be involved in the work of preventing death, but that's what all of us on this call have been involved in doing throughout the pandemic, right up to today, and we must continue in that work.
Thanks, Jenny. That's brilliant. Thank you very much. Okay. We have got some time left, and we have got some questions, some of which have been posted in the Q&A. Some have been sent to me directly, so we will try and cover them and give Deepti, Janet and Jenny the chance to answer them. So the very first question, the panelists will be able to see this, was from Rebecca Broadhurst, and it was about plans in place to support parents, or what are the plans in place to support parents of CV children who are below the vaccination age 5 to 11, especially with the hugely increasing numbers in schools and high levels of transmission without many of the previous mitigations. And Rebecca points out the US announcement today that Pfizer have asked the FDA to approve the 5 to 11-year-old vaccine. So vaccines, children, colleagues, Deepti, do you want to comment on that?
I think all I can say is there are no protections in place. I mean, there are no mitigations in schools. Children aren't allowed to shield. They're not allowed to remotely learn either. They still have to attend school mandatorily, which is being challenged, I think, currently by the Good Law Project. But, you know, the government is just delaying sort of responding to their pre-action letter. So, yeah, and I'm not terribly hopeful about the authorization. I mean, I think MHRA, again, our regulator, will authorize those vaccines for that age group. But I'm, again, very, very worried about what JCVI will do on this, given their track record in adolescent vaccination. So I don't see help coming in that regard anytime soon. So I think it has to be local action from schools to put in mitigations in place for those age groups, which is masks, ventilation, and do whatever they can, because I don't think there's any help coming from DfE or government.
Thanks, Deepti. Jenny or Janet want to add to that at all?
So I've been representing a member throughout the pandemic whose daughter is CEV and isn't able to be vaccinated because of the nature of her condition. And it's a sort of multiply layered issue, really, because the mother herself is a teacher in a school where she's having contact with lots of children, and the school hasn't been particularly careful to make sure that she's kept safe. She also has a son in the school where she teaches, and the daughter in a special school. And the daughters, the nurses at the special school phoned the mother to say that there'd been positive cases in her class, but at the same time the nurses said, we're meant to tell you that you have to continue to send her in. I mean, she's making the choice to keep her at home, and she knows she's not meant to, and everyone's told her. But at the end of the day, you have to put your own family's health first, don't you?
I would just, I mean, it's an awful situation, isn't it, that we've got into, where we're forcing people into unsafe workplaces. And when you look at the HSC guidance on these things for ordinary workers, is that we should be expecting our employers to put in place additional controls if people are more vulnerable. And that's the bottom line, like, you know, that we expect employers to do more for people that are vulnerable, and we expect them to do more with the staff. But you know, we have to be working with parents of children who are vulnerable as well, to see what pressures we can put on the schools to ensure that they can continue to be at home if they need to do, or to look at other ways of making sure that they're safe in that environment. Is there other rooms? Is there different times? Is there other things that we can do to mitigate against the risks that they are facing?
Thanks, Janet. I'll read out the next question that talks about vaccinations as well. There's a link there. Anonymous attendees has posted. Our school has said that the local authority is asking about unvaccinated staff, and this has caused the staff to question if that's allowed because it's medical information. They've also said that there will be a risk assessment done for those staff. Our local secretary advised there is no legal obligation, but they understand the reason. What do you think we can do in this situation? So being asked about vaccination status. Jenny, do you want to kick off with that one?
I might not have all my facts correct on this. I would have thought that it was confidential medical information and that you're not obliged to say whether you've been vaccinated. And what I would also say is we know of lots and lots of members who've become quite seriously ill with COVID, despite the fact that they have been double jabbed. We've, on all our union members' WhatsApp groups, there's countless stories. I think in one region there's 14 members hospitalised and 5 of them had been double jabbed. So I'm not sure it's all about the vaccinations anyway.
Thanks, Jenny. Janet, Deepti?
Well, I would agree with what Jenny's saying. You know, I think we shouldn't get hung up. You know, we should be encouraging people to get vaccinated, but we still have to have it in place. It's just another mitigation in trying to keep people safe. and we should have in place other mitigations to help, because not everybody is vaccinated. Well, if you're vaccinated, you can be infected, you can be infectious, you can be seriously ill. So it isn't the answer, the silver bullet. We've got to keep in place all the other mitigation. And as new variants come along, how effective is the vaccination going to be with those? So I think it's problematic what people putting all their eggs into vaccination. Hopefully it's going to solve the problem. It's going to help us. But I don't think at this point in time we can say that that's the surefire way of stopping the spread of the virus.
No, thanks, Janet. Did you want to add anything to that, Deepti, or shall we move on? No,
I think
correct.
Janet covered everything I would have said, yeah.
All right, thanks for that. But in terms of mitigations, another question there from Tom Matthew, who says, my head teacher has instructed all pupils to wear face coverings in all communal areas, but not in classrooms. He's left it to staff discretion over the wearing of face coverings. Can you give any advice over raising the level of measures they could welcome? Another question's just popped up. My feeling is it would be a reasonable step to require everyone in the school community to protect themselves and each other by wearing face coverings in all indoor spaces. So face coverings, entitlement to use them, that line. Who wants to go first? Competition. Jenny, I think hand was just up first.
Just 3 things on that. One, the school's risk assessment should be reviewed after every positive case. That's what we've been told all along. So if you review the risk assessment after a positive case and you don't currently have face masks in the classrooms, that's something that could then be added in as a mitigation because there's now been another positive case. And if not, say to the head, well, we're reviewing this risk assessment because there's been cases, surely it's meant to be more stringent each time we review it, not less or the same. Secondly, there should be proper individual risk assessments in place for more vulnerable staff. And those vulnerable staff have a right to be protected. So if they're in a class situation where it's left to other people's choice whether they wear a mask or not, then the person who's vulnerable isn't having the choice. So how is that looking on that risk assessment, and has that risk assessment been done properly? And thirdly, when the CO2 monitors come into school, if they ever do, from the DFE, they have started arriving in special schools, and if they don't persuade your school to buy one, like mine have, if you see the CO2 monitor in the classroom going up above 800 parts per million and you've already got all the windows open, there's nothing else you can do other than put face coverings on to try and bring down the levels. And if that still doesn't bring it down, then it's down to the walking out and going somewhere else instead.
Thanks, Jenny. Deepti?
Yeah, to me, the whole masks in communal areas but not in classrooms makes zero sense, given that's where children spend most of their time, with other children probably get infected over prolonged periods of time. And I don't understand the resistance to this, honestly. I mean, every other European country, I think, except for Sweden, which shouldn't be an example, and perhaps the Netherlands, has masks, not just in secondaries, but also primary schools. I mean, in France, the government provides FFP2 masks. I mean, we haven't even reached the point in the conversation where we're talking about the type of mask, which also makes a huge difference. So I don't see the resistance to putting these in classrooms, given kids tolerate them really well. And they would massively, benefit children's health and reduce educational disruption. And there's so much evidence from the CDC that, if you're interested, I can send you, where, that has shown that masks are really effective, and schools that had mask mandates had 37% lower outbreaks, and studies on like 1 million children in Utah that showed that wearing masks reduced the outbreaks and allowed schools to remain open. So why we're having this debate here and this level of skepticism with masks is something I don't understand.
No, I don't think many of us do, Deepti, but a lot of what you mentioned before about Us for Them and the Heart disinformation lobby group is certainly a factor in that. A follow-on question for that's directly linked to what you just said. It's a straightforward one. I'm not sure it's from just a member or a rep. Can we insist on seeing COVID-19 risk assessments in schools? Can we insist on seeing them? Janet?
Yes. Yeah, I mean, we should. That is health and safety, isn't it? That we know what the risk assessment says. We know that the employer has identified all the risks that's in that workplace, and that they are controlling them. and safety reps have the right to see that information. You know, anybody's got the right to see that information. I think parents should be asking for that information. We should be getting, you know, should have as much transparency about the risks and the way that they're being controlled as we can. You know, and I'll just go back to the point about face masks that Deepti and Jenny talked about, because we should be demanding proper precautionary level standard of PPE now. You know, that this isn't just about infecting other people. This is about your protection. And teachers and anybody in inside spaces must be protected from the virus, because it's circulating so widely that, you know, even with the ventilation, even with all the other things in place, that is not going to control it. It's a multi-layered approach to controlling that spread of that virus. And so demand FFP2 minimum PPE and provided by your employer.
Thanks, Janet. I'll move on to the next question, if that's okay. And it's around CO2 monitors as well, and I know you've all mentioned them already. And that's it's from Rebecca again. It says, on the case of CO2 monitors in my own classroom, I provided my own monitor, and even with windows open and ventilation fan on, it was regularly up to 4,000 ppm. How can this be tackled? That sounds tremendously high. So how can this, so a very high CO2 monitor reading, how can that be tackled? Go on, Deepti.
Yeah, I mean, I don't find that surprising at all. In fact, I find the whole idea of putting CO2 monitors in schools rather than investing in, you know, ventilation, air filtration devices ridiculous, because they seem to think that the CO2 monitors will show that, you know, many classrooms have adequate ventilation. I think if you have 30 children in a classroom, you know, no matter how many windows you have, I think it's very unlikely that your CO2 levels will be below 800. So, I mean, the only options that you have here, you really need to supplement ventilation. And it's very hard to do without support. So, you know, you need those HEPA filtration devices in to bring, they won't bring the carbon dioxide levels down because they don't act that way, but they will suck in the aerosols and make the environment a lot safer by reducing the virus content if somebody's infected in the classroom. And, you know, you can get them into a classroom for about, you know, £400 per classroom, because each device will cost about £200. There are also ways you can make it yourself for a cheaper cost, about £100. But, you know, I don't think the difference is that huge in terms of buying it. So it depends on whether the school can resources or you can crowdfund it. Having said that, we crowdfunded it for a school and are now being blocked by local education authority. So, you know, that can also happen. So I don't have any easy solutions apart from the fact, keep things outdoors as much as you can. And if you can, supplement ventilation some way through HEPA air filtration devices or through sort of fans that can suck out the air in the window, which I know is complicated. I don't see what the solution to this is.
Thanks, Deepti. Jenny or Janet want to add anything? Jenny?
It's worth remembering with the purchasing of air filters, what money you save by having one. Because what we're finding is where schools are having every single window open and the weather's freezing cold, the school's heating bill will go up. And then the other thing is, by not having them and all the staff being in rooms that are 4,000 parts per million CO2, quite apart from COVID, you're just going to have more sickness. You're going to have more infections spreading in general, and people will be off sick for longer. And for a lot of schools that buy into an insurance policy that pays for the agency cover when a teacher's off sick, some of those don't kick in for 2 weeks. So for the first 2 weeks, the school is having to pay that agency cover out of their own funds before the insurance kicks in. The amount of that is probably more or the same as the price of an air filter. So I think it's worth putting that as a business case. And the other thing is having the CO2 escalation thing embedded in your school's risk assessment, because not only do you have a right to see the risk assessment, but you have a right to be consulted on it and involved in it. So make sure it says in there, if I use my CO2 monitor and it goes up to this level, what's the control measure at that point? What happens as a result?
Thanks, Jenny. Did you want to add anything, Janet, on that?
No, I think it's been covered, everything. But I would say, you know, on top of it all, you know, if we're not going to be able to get those levels down, we're not going to be able to put as much air good air quality in those classrooms, then we need to think about different ways of doing it. You know, should we have less people in that space for less time? You know, how can we put different things in place to protect people? Is it that we take some of them out, or take some of them out for a particular, and look at the activity that's going on in that classroom as well? Because the more you're speaking, the more you're active, the higher the rates of CO2. So we need to think about that as well.
Thanks, Janet. And sort of nice link into the next question that I've got in front of me from Tamara Lindsay, who says that she works in a college where masks were mandatory in communal areas but not classrooms, and she registered her discontent. This week they announced masks are not required at all. Tamara says that she's CV and I've had 3 positive students. What can I do? I work in the smallest room, and well done to Tamara. She says she's negotiated a cap on capacity of 15 learners. So what can she do? Janet?
Well, she needs to register a concern with the HSE if she has it escalated through the internal procedures in the college, because they're putting her at risk. She needs to see the risk assessment, see what it says, because they should have evaluated it before they even took out any masks at all. But I think, you need to register all those concerns. You need to get an audit trail going, in your paper trail going in your schools and colleges as to and challenge your employers, because it is their duty. And when I say about their duty, they've got a legal duty to protect you. And we need to, force that on the employer and say, what are you doing? This is you that's going to be in the docks if anybody's harmed or made ill. Why are you doing this? So, hold them to account, make sure there's a paper trail of what you're doing, and then escalate it to the HSC. We need to put pressure on the HSC and the enforcement authorities to start enforcing those controls of the risks.
Deepti?
Yeah, I just want to, in this situation, can she wear an FFP3 mask, even the students can't? So generally we say masks, I think the prevalent thinking was that masks are largely for source control, but we know that's not true. And we know they also protect the wearer, but particularly FFP2 and FFP3 masks will protect the wearer, even if nobody else in the classroom is wearing masks, as long as it's not taken off. I mean, of course, not 100% protection, but it's pretty good protection. So if she's allowed to wear an FFP3, she should absolutely do that.
Thanks, Deepti. Good advice there. Jenny, did you want to add anything, or shall we move on?
I think it's covered, but just to underline what Janet said, some of these employers are acting against the law.
Absolutely, yeah. And not forgetting that DFE guidance is just that, guidance, and does not supersede health and safety law. Okay, so another question that's related to that, and it says, what if the head teacher refuses to share information about positive cases in their classroom? Doesn't say any more than that. So if there's a positive case in the classroom that presumably they found out about by other means, but the head teacher is refusing to share that information, what can the member do about that? Jenny?
I know Terry's here. I don't know whether he's got the facility of sharing something on the chat that we were having a discussion about this morning. We know that there are exemptions to the GDPR legislation, which everybody keeps quiet about. And people are very keen to say, oh, I can't tell you that because of GDPR. But there are actually exemptions in relation to safety at work. So it's not the case that you can't be told certain information where you need that information in order for people to be protected. So at the very least, the safety rep should be shared information that's allowing the school management and unions to work together to keep everybody safe. I think Terry's posting stuff now. Thanks,
Jenny, and thanks, Terry. Janet?
Yeah, I just come in because safety reps have the right to investigate if there's infections and things are going wrong in their workplaces and the schools. And I know this is happening across in different workplaces as well, where people are being refused that information. In universities, for example, but other ones as well. I also know that in lots of workplaces, like manufacturing, they're not only told where people are infected, but actually the names of people and then they investigate if there's any transmission within the workplace. So this isn't happening across the board in all industries and all sectors. This is particular employers that are refusing to give that information. And as a result of that, you won't be able to investigate whether it's transmission risk. And, it's about controlling those risks, isn't it? It's about keeping you safe and keeping, the children safe as well, that the young people are safe, that you work with. So we should be demanding of our employers that they, of the school heads, that they give you that information in an anonymous form if they need to do. But where the infections are taking place and who's going to be put at risk as a result of it.
Yeah, thanks, Janet. Okay, I'm conscious of the time now, and I want to be able to give each of the panelists a chance to just do a summing up at the end. We've got a question from one of our colleagues, Karan Bales, here, and he has apologised for it being lengthy, so I'll read it out. I'm not sure if the panelists can actually see it. So it says, in the last week, I've had meetings with Anthony Leonardi, the immunologist, and Mia Rubin, I don't know if I've said that right, who advises the Israeli government. We now know COVID erodes the immune system and causes health conditions like diabetes. Reinfections are more likely to cause severe disease. The consequences of multiple reinfections over the course of years is alarming. Do we need an information campaign that we need to think of COVID to be more like HIV than flu, and how unsustainable living with it is it? I think it's meant to be, is it? How can we cover this in risk assessment? So Karan's done an incredible amount of work, by the way, throughout the pandemic. Who wants to try and respond to that? Deepti.
I completely agree with Karam. This whole conflation of COVID with flu is really, really concerning. People keep saying, oh, it's just a novel virus, it'll become endemic, it'll become benign. The actual truth we're seeing is very concerning. We're seeing this is a neurodegenerative disease. It invades the brain, it affects the brain even in young people with acute infection. Even in children, there are metabolic changes in the brain that continue for 5 to 6 months at least, if not longer. And we know that people in long COVID have as Karan was saying, immune dysregulation for long periods of time that can leave them susceptible, possibly even to other virus infections. They have autoantibodies which attack different parts of their tissues. We know even young healthy people with mild infections have reduction in kidney function. So the idea that children can be exposed to this virus again and again, and it'll boost their immunity without having long-term impacts is something that, I find quite terrifying, the idea. I think every time a child gets infected, it might have long-term effects on them that we'll only understand, years later. And what we know right now is extremely worrying. To me, this is a long-term multi-system disease. This is not an acute infection. It has long-term impacts on the immune system, on almost every organ in the body. And to treat it like flu is completely wrong and disingenuous. And to think that, exposing children to it again and again is fine is, in my view, completely wrong.
Absolutely. Jenny or Janet, do you want to add anything to that response? No. Okay. I've got one more question here, and it's perhaps more directed towards Deepti, but actually I'm sure Jenny and Janet will be able to come in on it as well. Given the current trajectory and the way the data is looking and the virus still spreading, what do you see happening to case rates and infections over the next few months up to Christmas? So predictions. Deepti?
So yeah, it's very hard to make predictions at this point in time, but what we're seeing is a dual pandemic. So we're seeing massive rises in unvaccinated people, which is largely children at this point. And we're seeing continuing drops in other people. So it looks like case rates are flat, but that's sort of hiding this really dual picture. I think what happens in the future is highly dependent on a number of factors. One, I think what happens with vaccination in children is a big question, how quickly it's rolled out. Looking at the rate at which it's being rolled out, I expect to see a lot more long COVID in children, which is what the ONS data today also shows. It shows much higher levels of long COVID in children than, for example, we had even in August. And I expect that will continue to increase. In terms of cases, It depends on how quickly vaccination is rolled out. If it's rolled out very quickly, we might see them remaining flat or slightly increasing. Because the vaccination will take an effect. Even now, for example, we're seeing in 16 plus age groups, cases are dropping because of vaccination, while in 10 to 15-year-olds, they're rising up high. But I think we will keep seeing a lot of hospitalizations and deaths, sadly, because we're allowing massive rates of infection, and there will be breakthrough infections, and there will be people who are either clinically vulnerable, who don't respond sufficiently to vaccines, and waning immunity, giving boosters are not really being rolled out at the pace that they are supposed to be rolled out either. And I think we've been taught to normalize maybe 30 to 50,000 deaths a year, and 1 million people living with long COVID. And this is now our future, a reduction in life expectancy. We're already seeing that across Europe and in the UK in men. And I think in the long term, what we're looking at is reduction in life expectancy, NHS unable to provide care to people, and particularly young people who are unvaccinated being hung out to dry, and mass chronic disability from long COVID.
Thanks, Deepti. Janet?
Yeah, I'll just add that, winter is obviously going to be a lot more risky for us. We're going to have windows closed, the whole atmosphere will have an effect on circulation of the virus. And as more people get the virus who've already been vaccinated, even, that this is going to be impacting massively on our health, and will leave people with long COVID, I think, as Deepti said before. So this is a really worrying time. We need a proper action to try and take control of the transmission of the virus. We have to get back to that, because otherwise we're going to see more variants come along, and and more variants might not be protected. Might not be protected through vaccination. So it's extremely worrying, I think, as we come up to winter.
Thanks, Janet. Okay. Thanks very much to Janet, Jenny and Deepti, and for everybody joining us for the questions. Apologies if we haven't covered them all. We are going to save the chat, and if we haven't covered things, we'll try and get a response back to you. Deepti, if it's okay for you to share your slides with us, we'll find a way of circulating those. We've recorded this meeting, so you can share that in your districts far and wide. So just before we close, we'll just give each of the panellists a chance to say something as part of a summing up, and we'll do it the other way around. So Jenny, if you want to kick off.
Well, I just noticed somebody just typed in the chat that we're being sacrificed for the economy, and that's kind of what I want to agree with as the final statement, really. I think both us and the children are being sacrificed for the economy. In my school, we had a lovely TA that died in the summer of COVID, and she contracted COVID at school. And her name was Dawn Millwood. I want to say it now, and I want to sort of dedicate this little bit to her. And I want us to kind of fill all of our sort of Dawn-sized holes in our schools with the renewed energy to fight collectively for safety and to try and improve things, because nobody else is going to do it for us. We just have to basically take it into our own hands.
Thanks, Jenny. Janet?
Yeah, thank you very much. And I'm so sorry that we're losing, that people have got these experiences of the loss of the friends and colleagues in schools, and and the children that you're teaching, because it isn't fair, it isn't right, it shouldn't happen, it doesn't need to happen. We hold our employers to account. That's the thing that we can do in our schools. We force them to control the risks that we know are there. We know how to control those risks, and we know our employers should do it. We've got to force them to do it. And if that means, jumping up and shouting, jumping up and down on MPs and local councillors, do what you can to force those schools to protect you and protect your children, and escalate. Keep safe and escalate. You've got to make sure that there's proper mitigations in place.
Thanks, Janet. And Deepti.
Sure, I'll keep it short. What's happening here is a scandal, and we shouldn't normalize it. We have a government that's actively putting people in schools at risk, both staff, children, and the wider families and communities. And they've not just hung people out to dry, they've put in policies that actively promote infection. And I think it's important to recognize that. So we have to keep challenging them. Were we living in another country, this wouldn't be happening. So we are an exception here. And what we need is coordinated action at citizens level, at unions level, to counteract what's happening, because we have a government that's actively putting people at risk, and that's not something we should accept.
Deepti, thank you very much. Thanks to Janet and Jenny once again. Thanks for everything that you've been doing throughout the pandemic. Keep doing it. I'm sure we'll be hosting another one of these meetings at some point soon, hopefully with some positive news. But you've all said the same things. We need to take action. We need to organise, do what we can, and push back against what's going on. So thank you very much to everybody that's joined. Please share this with your colleagues far and wide. And thanks for that. Enjoy the rest of your evening. Thanks very much.